Imagine this for a moment. You're over 75, you walk every day, you do everything you were told was right. Yet standing up feels harder, balance feels uncertain, and simple movements demand more effort than they used to. That's when an uncomfortable question appears. If walking is so good, why does the body still feel weaker? Here's what really happens after 75 and why many orthopedic surgeons now warn that walking alone is no longer enough to protect your joints, your balance, or your independence. The truth isn't meant to scare you. It's meant to give you back control. Walking is familiar, comforting, and beneficial for the heart. No orthopedic specialist denies that. But after 75, the body changes in very specific ways. Muscle loss accelerates, joint cartilage becomes more sensitive to poor alignment, reaction time slows, and balance relies far more on strength than endurance. Walking is repetitive and low load. It moves the body forward, but it doesn't strengthen the structures that keep joints stable. It doesn't rebuild muscle power, and it doesn't train the body to react when something unexpected happens, like a slip, a step to the side, or a sudden loss of balance. That's why so many people who walk daily still experience falls, joint pain, or fear of movement. Orthopedic surgeons see this pattern every day. Patients come in saying they walk regularly, yet they struggle to rise from a chair, climb stairs, or maintain balance on an uneven ground. The issue isn't effort, it's stimulus. Walking doesn't load the bones enough to maintain density. It doesn't activate the deep stabilizing muscles around the hips, knees, and spine. And it doesn't challenge coordination in a way that protects joints from wear and tear. Over time, joints begin absorbing forces that muscles should be handling, and that's when pain, stiffness, and instability appear. So what should be done instead? The answer isn't to stop walking completely, but to stop relying on it as the main solution. After 75, movement needs to become more intentional. The body needs exercises that strengthen muscles where they attach to the joints, restore alignment, and teach the nervous system how to protect you during everyday movements. These are the movements orthopedic specialists consistently recommend because they directly support joint health and reduce fall risk. The first focus is controlled sit to stand movements. Standing up from a chair without using the hands is one of the strongest predictors of independence after 75. This movement strengthens the thighs, hips, and core, the exact muscles that unload stress from the knees and hips. When these muscles are strong, joints move more smoothly and with less pain. Surgeons often emphasize this because weak legs force the joints to absorb impact they were never meant to handle. Next comes hip stability. Many joint problems in the knees and lower back actually begin at the hips. When the hips are weak, the pelvis tilts and joints fall out of alignment. Simple movements that strengthen the side hips help keep the pelvis level, reduce knee strain, and improve balance. This type of strength is critical after 75 because most falls happen sideways, not forward. Then there's ankle and calf strength, an area almost everyone overlooks. Orthopedic surgeons know that weak ankles mean delayed reactions. When the feet can't respond quickly, the entire body loses its ability to correct balance. Strengthening the calves and ankles improves circulation, reduces swelling, and restores the body's first line of defense against falls. Core stability is another key factor. A strong core doesn't mean crunches. It means the ability to hold the spine steady while the arms and legs move. Without this support, joints take extra strain and posture collapses. Gentle isometric core engagement trains the body to stay upright and protected during daily activity. Finally, coordination and gait training become essential. Walking forward on autopilot doesn't challenge the brain. Movements like controlled marching retrain the nervous system, improve step height, and reduce foot dragging. Orthopedic specialists recommend this because many falls occur not from weakness alone, but from poor coordination between the brain and body. What all of this comes down to is simple. After 75, joints don't fail because you move too much. They fail because the right muscles stop supporting them. Walking keeps you moving, but it doesn't rebuild that support. Strength, stability, and coordination do. And the good news is the body can still adapt at this age. Bones respond to load. Muscles respond to activation. Balance improves when trained correctly. If you've been walking faithfully but still feel unsteady, stiff, or unsure, it's not because you're doing something wrong. It's because your body is asking for something more specific. A few minutes a day of the right movements can reduce joint stress, improve balance, and help you move with confidence again. Walking can remain part of your routine, but it should no longer be the foundation. After 75, protecting your joints and your independence means training the body to support itself, not just move forward. Imagine being over 75 and doing exactly what you were told would keep you healthy. You walk every day, you stay consistent, you make the effort. And yet, something doesn't add up. Standing up feels slower. Balance feels less automatic. Small movements require more attention than they used to. This is the moment many people quietly blame age, but orthopedic specialists see a different picture. The issue is not that the body has stopped responding. It's that walking no longer gives the body what it actually needs at this stage of life. After 75, the body undergoes changes that are very specific and very predictable. Muscle mass declines more rapidly, especially in the legs, hips, and deep stabilizing muscles. Reaction time slows. Joints depend more on muscular support to stay aligned and protected. Walking, while beneficial for the heart and circulation, is a low-load, repetitive activity. It moves the body forward, but it does not ask muscles to generate meaningful strength. It does not challenge balance in unpredictable directions. And it does not train the body to react quickly when something unexpected happens. From an orthopedic perspective, this matters because joints are not meant to carry load alone. Muscles exist to absorb force, stabilize movement, and protect cartilage and bone. When muscles weaken, joints take on stress they were never designed to handle. This is why people who walk daily can still develop knee pain, hip discomfort, or lower back stiffness. Walking does not strengthen the muscles enough to unload these joints. Over time, the same forward motion, repeated thousands of times, reinforces existing weaknesses rather than correcting them. Another critical limitation of walking after 75 is balance training. Most walking happens on flat, predictable surfaces. The body quickly learns that it does not need to make rapid adjustments. But real life is not predictable. Balance is challenged when turning, stepping sideways, reaching, stopping suddenly, or recovering from a small misstep. Orthopedic specialists know that most falls do not happen during long walks. They happen during everyday tasks at home. Walking does not prepare the nervous system for these moments because it does not train lateral stability or quick corrective reactions. There is also the issue of muscle power. Strength and power are not the same thing. Power is the ability to generate force quickly, and it is essential for preventing falls. When you trip, you do not have time to think. The body must respond instantly. Fast, reacting muscle fibers decline rapidly with age if they are not trained. Walking does almost nothing to preserve them. This is why someone can walk for years and still be unable to catch themselves during a stumble. The muscles are active, but they are not responsive. Posture is another area where walking falls short. Many older adults walk with a slight forward lean, reduced arm swing, and limited hip extension. Over time, this reinforces a collapsed posture. Weak glutes and a disengaged core place more strain on the spine and knees. Walking does not correct this pattern. It often makes it more ingrained. Orthopedic specialists frequently see patients who walk daily but still struggle with back pain or joint stiffness because the underlying support system is weak. There is also a psychological side that is rarely discussed. When walking is the only form of movement, the body becomes good at one thing and less capable at everything else. Standing from low surfaces feels risky. Stairs feel intimidating. Uneven ground creates hesitation. This leads to cautious movement, which further reduces muscle activation. The body adapts to caution by becoming weaker. This cycle happens quietly and gradually, often without awareness. Understanding that walking is not enough after 75 is not about discouraging movement. It is about precision. Orthopedic specialists do not tell people to stop walking. They warn against relying on it as the foundation of physical health. The body at this age needs targeted strength to protect joints, deliberate balance training to prevent falls, and coordination work to maintain safe movement. Walking alone does not provide these elements. When walking is combined with movements that build strength, stability, and reaction speed, it becomes more effective and safer. But when it stands alone, it leaves critical gaps. These gaps explain why effort does not always equal results. The body is not failing. It is simply asking for a different kind of stimulus, one that supports joints, restores confidence, and keeps independence intact as daily demands become more complex and less forgiving. Imagine how many times a day you rise from a chair without really thinking about it. The dining chair, the sofa, the toilet, the edge of the bed. This simple action quietly defines independence after 75, yet it's one of the first abilities to fade. Orthopedic surgeons pay close attention to this movement because it reveals exactly how well the body is supporting its joints. When standing up becomes slow, difficult, or requires using the hands, it's a clear signal that the muscles meant to protect the knees and hips are no longer doing their job. The sit to stand movement is not just an exercise. It is a real life test of leg strength, balance, and coordination. Every time you stand, your body must shift its center of gravity forward, engage the thighs and hips, stabilize the knees, and keep the spine aligned. When these systems work together, the movement feels smooth and controlled. When they don't, the joints absorb excessive stress. Knees take the load. Hips feel stiff. The lower back compensates. Over time, this compensation leads to pain, instability, and fear of movement. After 75, muscle loss accelerates, especially in the quadriceps and gluteal muscles. These muscles are designed to lift your body weight and absorb force. Walking barely challenges them. It keeps them active at a low level, but does not train them to generate strength. As a result, standing up becomes one of the most demanding tasks of the day, even though it should be automatic. Orthopedic specialists consistently emphasize strengthening this movement because strong legs reduce joint stress more effectively than almost any other intervention. When the quadriceps are strong, they control how the knee bends and straightens. They act like shock absorbers, reducing pressure on cartilage and ligaments. Weak quadriceps allow the knee joint to collapse inward or shift forward, increasing wear and discomfort. Similarly, strong glutes stabilize the hips and prevent excessive strain on the lower back. When these muscles weaken, the body relies on momentum instead of control. People rock forward, push with their hands, or brace themselves before standing. These compensations increase fall risk and reinforce weakness. Practicing controlled sit to stand movements retrains the body to use proper mechanics. Sitting down slowly teaches control. Standing up deliberately rebuilds strength. This control matters because it improves balance. Rising from a chair challenges stability more than walking does. The body must coordinate multiple muscle groups at once. Practicing this movement restores confidence in the legs and improves balance reactions without requiring speed or impact. Orthopedic surgeons also value this movement because it loads the bones safely. Bones respond to load by maintaining density. Walking provides very little stimulus for bone health after 75. Sit to stand movements place controlled load through the hips and thighs, signaling the body to maintain strength where fractures are most devastating. This is why this movement is often included in rehabilitation and fall prevention programs. There is also a profound psychological effect. When standing up feels easier, fear decreases. People stop avoiding low chairs. They move more freely around the house. They trust their legs again. This trust changes how they walk, how they turn, and how they interact with their environment. Orthopedic care is not just about reducing pain. It is about restoring confidence in movement, and few movements do this more effectively than sit to stand strength. Another overlooked benefit is how this movement improves circulation. Activating large muscles helps pump blood back toward the heart, reducing stiffness and heaviness in the legs. This makes standing and walking feel less tiring throughout the day. Many people notice they feel more energized after practicing this movement, even though it seems simple. Importantly, this is not about doing endless repetitions or pushing through discomfort. Quality matters more than quantity. Slow, controlled movements teach the joints how to move safely. Over time, the legs become stronger, balance improves, and joints feel more supported. This is why orthopedic specialists often say that the ability to stand up easily is one of the clearest indicators of how well someone will maintain independence after 75. When this movement is restored, daily life expands instead of shrinking. Stairs feel less intimidating. Getting out of the car feels safer. Even walking improves because each step is supported by stronger legs. Walking becomes smoother not because you walk more, but because your body is finally strong enough to support it the way it was designed to. Many people are surprised to learn that pain or instability in the knees and lower back often has very little to do with those joints themselves. Orthopedic surgeons frequently trace these problems upward to the hips. After 75, hip stability becomes one of the most important factors in protecting the entire lower body. When the hips are strong and stable, joints below them move in alignment. When they are weak, the body begins to compensate in ways that slowly damage joints and increase fall risk. The hips act as the body's central hinge. They connect the legs to the pelvis and control how force travels through the body with every step. When the muscles around the hips weaken, especially the muscles on the sides of the hips, the pelvis begins to tilt with movement. This tilt may be subtle at first, but it has consequences. Knees start collapsing inward. The lower back twists slightly with each step. Walking becomes less efficient and more stressful on the joints. Walking alone does not correct this pattern because it repeats the same faulty mechanics over and over again. Orthopedic specialists focus heavily on hip stability because it directly affects joint alignment. Strong hips keep the pelvis level when standing on one leg, which happens briefly with every step you take. Without that stability, the body shifts weight awkwardly, creating sideways sway. This sway is one of the main contributors to lateral falls, which are particularly dangerous after 75. These falls often lead to hip fractures because the body cannot correct itself in time. Targeted hip strengthening restores this control. When the side hip muscles engage properly, the pelvis stays centered. Knees track more naturally. The spine remains upright instead of compensating. This alignment reduces joint wear and often decreases pain without directly treating the painful joint. Many people are surprised to notice that knee discomfort eases once hip strength improves. Even though the knee itself was never exercised aggressively, balance improves significantly when hip stability is restored. Standing tasks that once felt shaky become easier. Turning feels smoother. Weight shifts happen with more confidence. This is because the hips are now doing their job as stabilizers, allowing the rest of the body to relax. Orthopedic surgeons understand that balance is not just about the feet. It is about how well the hips control the body's center of gravity. Another important aspect is posture. Weak hips often lead to a forward, leaning posture as the body searches for stability. Over time, this posture increases strain on the spine and reduces lung capacity. Strengthening the hips helps bring the body back into alignment. Standing feels taller. Breathing feels easier. Movement feels less effortful. These changes are gradual but deeply impactful. Hip stability also plays a role in confidence. When people feel unstable, they move cautiously. Steps become smaller, movements become guarded. This caution reduces muscle activation, which leads to further weakness. Strengthening the hips breaks this cycle. As stability improves, fear decreases. People begin moving more naturally, which further reinforces strength and coordination. Importantly, hip stability does not require fast or aggressive movement. Controlled, deliberate exercises teach the muscles to engage when needed. This makes the approach safe and effective after 75. Orthopedic specialists favor this method because it strengthens joints without stressing them. Over time, the hips regain their role as the body's stabilizing anchor. When the hips are stable, walking becomes safer and more efficient. But the real benefit is not walking itself. It is the ability to move in all directions with control. Stepping sideways, turning quickly, adjusting to uneven ground, and recovering from a misstep all become easier. These are the movements that protect independence. After 75, joint health depends less on how much you move and more on how well your body supports itself. Hip stability is a cornerstone of that support. When it is restored, joints move in harmony instead of conflict, balance improves without conscious effort, and everyday movements regain a sense of ease that walking alone cannot provide. After the hips, The next system orthopedic specialists pay close attention to is the ankles and calves. These muscles rarely get credit, yet they are the body's first line of defense when balance is challenged. Every time your body sways forward, backward, or slightly to the side, the ankles respond before anything else. After 75, if these reactions slow down, the entire balance system becomes less reliable. Walking on flat, predictable surfaces does not keep this system sharp. It allows it to fade quietly. The calves act like a pump for both movement and circulation. When they contract, they help push blood back toward the heart. When they weaken, swelling, heaviness, and stiffness in the lower legs become more common. Orthopedic specialists know that poor circulation in the legs is not just uncomfortable. It affects muscle responsiveness and joint health. Muscles that are poorly supplied with blood react more slowly, and slower reactions mean less protection when balance is suddenly challenged. Ankle strength is equally important. The ankle joint is small, but it plays a massive role in stabilizing the body. When you step on an uneven surface or shift your weight unexpectedly, the ankle must adjust instantly. If it cannot, the body relies on the knees, hips, or spine to compensate. These joints are not designed to react as quickly, which increases the likelihood of a fall. Walking does not challenge this reaction speed because the terrain and movement pattern remain the same. Orthopedic surgeons frequently observe that people who fall often do not lack effort or motivation. They lack ankle responsiveness. Their steps look careful, but when something unexpected happens, the body cannot correct itself in time. Strengthening the calves and ankles restores this responsiveness. It trains the muscles to engage quickly and effectively, improving the body's ability to recover from small disturbances before they become dangerous. Another important benefit of ankle and calf strength is improved alignment throughout the lower body. Strong ankles help keep the foot stable, which supports proper knee and hip alignment. When the ankles collapse inward or outward, the entire leg follows. This misalignment places stress on the knees and hips, accelerating joint wear. Orthopedic care often focuses on correcting this chain reaction because addressing the ankle can protect joints higher up. Balance confidence improves dramatically when the ankles feel strong. People stop feeling the need to constantly watch the ground. They trust their footing more. This trust leads to a more natural walking pattern, which further improves stability. Fear decreases, posture improves, and movement becomes less rigid. This psychological shift is just as important as the physical changes. Calf and ankle work also supports endurance. When these muscles are active and responsive, walking feels less tiring. The body moves more efficiently. Each step requires less effort because the muscles are doing their job instead of relying on joint structures. Over time, this reduces strain and makes daily activity feel more manageable. Orthopedic specialists emphasize that this type of strength does not require aggressive movement. Controlled, deliberate activation is enough to restore function. The goal is not to push the joints, but to wake up the muscles that protect them. This approach is especially important after 75 when joint integrity matters more than intensity. When ankles and calves are strong, balance reactions improve. Small stumbles are corrected automatically. Weight shifts feel controlled. Standing feels steadier. These changes may not be dramatic at first, but they accumulate. Over weeks and months, the body regains a level of stability that walking alone cannot provide. This is why orthopedic warnings often include a focus on the feet and lower legs. They understand that strong ankles are not optional for safe movement after 75. They are essential. And when this foundation is restored, the entire body benefits from better alignment, improved circulation, and greater confidence in movement. After ankle strength, orthopedic specialists shift their attention to something that ties the entire body together: core stability and coordination. After 75, many falls and joint problems are not caused by lack of effort or even lack of strength alone, but by a breakdown in timing between the brain and the body. Movements that once happened automatically begin to require conscious control. Steps shorten, feet drag slightly. Turning feels less fluid. Walking continues, but it becomes mechanical and cautious. This is where walking alone truly fails to protect independence. The core is the body's central stabilizer. It includes deep muscles that surround the spine and pelvis and keep the body upright while the arms and legs move. When these muscles weaken, posture collapses subtly. The upper body leans forward. The pelvis tilts. The spine absorbs more load with every step. Walking does not correct this because it often happens with a disengaged core. The body moves forward, but without internal support. Over time, this increases strain on the joints and reduces balance control. Orthopedic specialists emphasize core stability not to build visible muscle, but to protect the spine and joints during everyday movement. A stable core allows the legs to move independently without throwing the body off balance. It keeps the center of gravity controlled. When the core is weak, even small movements like reaching, turning, or stepping over an object can destabilize the body. This instability increases fall risk far more than lack of endurance ever could. Coordination becomes equally important after 75. Coordination is the ability of the brain and muscles to work together smoothly and on time. Many falls occur not because someone is too weak to walk, but because the timing between lifting the foot and placing it down is slightly off. Feet begin to drag. Toes catch the floor. Steps lose height. Walking on autopilot does not challenge this system. It allows poor patterns to continue unnoticed. Orthopedic specialists often recommend controlled marching and deliberate movement patterns to retrain this coordination. Lifting one knee at a time teaches the brain to reconnect with the legs. It restores step height and improves rhythm. This may seem simple, but it directly addresses one of the most common causes of falls after 75. When the body relearns how to lift the foot properly, tripping risk decreases dramatically. Core stability and coordination also improve posture. When the core engages, the spine aligns more naturally. The head sits over the shoulders. The shoulders sit over the hips. This alignment reduces joint strain and improves balance without conscious effort. People often report that they feel taller, lighter, and more in control. These changes are not cosmetic. They are structural and protective. Another key benefit is reaction time. When the core is stable and coordination is trained, the body reacts faster to unexpected challenges. A stumble becomes a recoverable event instead of a fall. A sudden stop or turn feels manageable instead of frightening. Orthopedic specialists know that reaction time is one of the strongest predictors of fall risk. Walking does not train this. Deliberate coordination work does. There is also an emotional shift that occurs. When movement feels coordinated again, fear decreases. People stop bracing themselves before moving. They stop limiting their activity out of caution. This leads to more natural movement, which further reinforces strength and coordination. The body and mind begin working together again instead of against each other. Importantly, this type of training is safe after 75 because it is controlled and intentional. It does not rely on speed or impact. It teaches the nervous system how to move efficiently. Orthopedic specialists favor this approach because it protects joints while restoring function. It respects the realities of aging without surrendering to them. When core stability and coordination are restored, walking changes. It becomes smoother, more confident, and less tiring. But the real benefit is not the walk itself. It is the ability to move through daily life without fear. Standing, turning, stepping, and reacting all become more reliable. This is what orthopedic warnings are really about, not stopping walking, but stopping the assumption that walking alone is enough. After 75, the body needs support from the inside out. When that support is rebuilt, independence is no longer something you hope to keep. It becomes something your body actively protects every time you move.